Dr Kyle Hoath is the President of the Australian Medical Association of WA. Kyle, good afternoon, and thank you for coming on.
Thank you.
Now, we understand ChatGPT Health is already here for a small number of Australians. They're able to use it right now. Does it have merit, in your view?
Yeah, look, it's a really interesting question, actually. I think in the future it absolutely does, right? Like we shouldn't be too afraid of the fact that as our technology improves, our access to various things like healthcare and information should as well. But I'm going to have to put a big asterisk next to that statement.
Okay, talk us through the asterisk. So what are your concerns?
Well, it really always comes back to, what sort of information are you getting and from whom? I mean, I like to think of ChatGPT as an information source, really just a kind of better, more sophisticated version of Google. So it still can be helpful and still can give you useful information, but people have to be aware that it's not a replacement for seeing their doctor, and that it can be wrong. And being wrong can be disastrous when we're talking about people's health. So
how does the average person correctly draw that line, that distinctive line between advice that is general in nature versus advice that could be troublesome?
Yeah, well, you can't, and I think that's the challenge, right? And I think that if you are genuinely concerned about your health or well-being, or there is something that is of concern enough that you want to ask Google or ChatGPT, that you should be following that up with an appointment with your doctor to double-check that you haven't missed something or misinterpreted something. So again, it's probably I think a long time ago in my medical career, I stopped telling people to not Google things, because you can't stop people from doing that. But it's understanding what the information is, where it comes from, and where you can go, I guess, to get that single source of truth, just to kind of back it up or validate it, if you like.
So will it be a case then that doctors will try and educate their patients of how to use this tool?
Yeah, again, I'd like to see that, and I think we'll be heading that way in the future. The problem is we're still in that cycle of educating our doctors and everybody really around what AI is and what it can do and what it can't do. What its limitations and risks are. We haven't grown up with this, and it's evolving. I don't know about you, but it's evolving pretty quickly, and it's getting harder and harder to keep up with the new technology as it develops. So we absolutely need to teach people how to use these things safely, but at the same time, I think we're all learning ourselves.
So talk us through what you think the long game is here. So how are they using this service to get a good bottom line? And is there some concerns with some techniques they may be using?
Yeah, look, I'll give a good and a bad spin here, but the bad one will be just to always have that caution around why companies are doing things like this. And for OpenAI, the owners of ChatGPT, this is all about data. So they want your health data just like they want your browsing data and your movement data and everything else, because it ultimately helps them sell things to you, or they use that data to give to other people to sell to you. So we saw similar things with Google and then with Facebook, and have continued to see other companies taking advantage of the data that we put out there on the internet. And ChatGPT is still the internet. So you put something into ChatGPT, it's gone there forever, and can be used against you. So you've got to be really, really careful. I mean, the absolute paranoid part of me says, what happens when health insurers start to work with ChatGPT and get their hands on the health issue that you thought you were confidentially sharing with ChatGPT, but now your insurer has? There are some risks and things to be really conscious of when using services like this.
So as it stands, some Australians are using ChatGPT Health. Are they having to hand over a lot of their health data to get access?
Yeah, look, I mean, it sort of works as a very opt-in kind of thing. So you're sort of sharing what you want to share with ChatGPT, as you kind of currently can anyway. But it's just in a more bespoke environment that is designed to give you health answers. So yeah, they do need to share health data if they want an answer. Otherwise, it's not much different to what would be out there with the normal ChatGPT anyway. And yeah, for anyone not. For any doctors or anyone working in the health industry, just a reminder and a caution that the Privacy Act doesn't let us do that. We must be storing all health data in Australia and processing all health data in Australia. Pretty strict legislation around those things.
Just finally, how quickly do you think this is set to grow?
Astronomically quickly, and whatever I guess, it'll be wrong and different. Yeah, it's an exciting and bewildering thing to behold, the AI transformation, and health is not going to be sort of set aside as it has been in the past with some technologies. I think AI is very much here to stay and will become a very normal part of our day and our routines, as long as we all can learn around what is safe and what to be careful about.
All right. So your advice is really be careful, use with caution, and don't give it too much of your data.
I love that. You've nailed it. Thank you.
All right. Good on you, Kyle. Cheers. Thanks for coming on. Bye-bye. Dr Kyle Hoath, he's the president of the AMA in WA.